All right, so let's dive into this whole world of medical tests, huh? We're going deep on congestive heart failure, CHF.
Okay.
These tests, they can be a bit of a head scratcher,
Yeah.
right? But getting what they mean, it's like having that secret decoder ring for your health.
hmm
Especially, with CHF, where your heart's having a tough time pumping blood the way it should.
Yeah, it's amazing how much these tests can tell us, not just about your heart, but like, you know how CHF kind of has this ripple effect throughout your whole body?
Oh, I like that. Ripple
Yeah,
effect.
it's like, dominoes, one thing leads to the next.
Okay, dominoes. I like that analogy. So first off, we've got BNP and NT-proBNP.
Right.
These are like what, the canaries in the coal mine?
Yeah, you can think of them as your heart's like stress signals. When your heart's overworked, like a balloon that's stretched way too thin,
Uh-huh.
it starts releasing these proteins. And the crazy thing is, they often show up before you even feel like really bad symptoms.
No kidding. So that's really powerful then, right? For catching things early.
Exactly. Early detection is key. Now, a lot of people think high BMP or NT-proBNP, boom, that automatically equals heart failure.
Yeah.
But it's not always that cut and dry.
Okay.
There are other things that can cause those levels to spike too, like pulmonary hypertension,
Right.
kidney problems, even, nasty infections.
Wow. Okay, so it's not a simple yes or no, but it's definitely a clue for doctors.
Right. It's a clue.
So besides that early detection, what else do those tests help us figure out?
Well, they're great for gauging how severe the CHF is. Higher levels generally mean your heart's under more strain, so that helps doctors figure out the best way to treat it.
So it's not just about saying, yep, you've got CHF, but it's like, okay, how bad is it?
Exactly, yeah. It helps personalize the approach.
Makes sense. Okay, so let's move on to another one, the complete blood count,
The CBC.
the CBC, yeah. Seems pretty basic, but I hear it can uncover some hidden problems.
Oh, yeah, definitely. Things that can actually make CHF worse.
Like what kind of surprises can the CBC reveal?
Well, one thing that's often missed is anemia.
Okay.
If your red blood cell count is low, that means less oxygen is getting to your tissues,
Uh-huh.
which puts even more stress on a heart that's already struggling.
Right, because it has to work harder to make up for it. What else jumps out at you when it comes to CHF and the CBC?
Well, you got to look at the white blood cell count, too. If that's high, it could mean there's an infection brewing.
Oh.
And infections, they're bad news for anyone, but they're especially risky for someone with CHF
Yeah, I can see that.
because they can trigger inflammation, which further weakens the heart.
So even just a regular cold could be a bigger deal if you're dealing with CHF.
Exactly. It's all connected. That's why doctors, really watch those CBC results. Even small changes can be important. It helps them put the whole picture together and manage the person's overall health better.
It's like that whole domino effect we were talking about.
Yeah, exactly.
Okay, let's switch gears a little bit and talk about electrolytes. We know those tiny little charged particles are super important for our nerves and muscles to work right, including our heart.
Right, and that's where it gets interesting because some of the common medications for CHF, especially diuretics,
Diuretics.
yeah, those are like your water pills that help flush out extra fluid, right?
Right.
They're really important for relieving symptoms like swelling, but
Okay.
they can mess with the balance of electrolytes in the body.
Oh, okay. So what happens when those electrolytes get out of whack in someone with CHF?
Well, let's take potassium, for example. If the potassium level drops too low, it's called hypokalemia. And that can cause fatigue, muscle weakness, even dangerous heart rhythm problems.
Wow.
And the tricky part is, a lot of people might just think, oh, that's just my CHF acting up,
Hmm.
not realizing it could be a side effect of their meds.
So it's really important to get those levels checked regularly then, right?
Oh, absolutely. It's not just about taking the medication. It's about making sure it's actually working the way it's supposed to and not causing any other problems.
Right, making sure it's not doing more harm than good.
Exactly. And, speaking of how CHF and its treatments can affect other things, we got to talk about the kidneys. Because remember, the body's this complex system, and when one part's not working right,
Uh-huh.
it can throw other parts off too.
Ah, that domino effect again. So how does CHF mess with the kidneys?
Well, think of your kidneys like filters. They clean your blood,
Okay.
but when your heart's not pumping efficiently, it can actually reduce the blood flow to the kidneys.
Mm.
And that makes it harder for them to do their job to filter out those waste products.
So a weak heart could actually end up damaging your kidneys.
That's a real concern. Yeah. And that's where those renal function tests come in. They measure the levels of waste products like BUN and creatinine in your blood.
Okay.
And if those levels are too high, it could mean your kidneys aren't functioning as well as they should be.
So it's like the heart makes the kidneys worse, and then if the kidneys aren't working, that makes the heart even worse.
It's a vicious cycle, yeah.
Oh, man.
It's a tricky balance.
Yeah.
And that's why these tests are so important. Doctors use them to, you know, really fine-tune the treatment plan. Like they might change up the medications to protect the kidneys,
Right.
or even suggest some dietary changes to ease the workload on them.
Okay.
Mm.
So it's not just treating the heart. You got to look at the whole body, huh?
Exactly. It's a holistic approach. And speaking of interconnectedness, we can't forget about the liver.
Oh, right. The liver.
Yeah. Just like with the kidneys, that fluid buildup from CHF can impact liver function too.
Right, because it's all kind of connected, right? Like that domino effect.
Right.
What are some signs that CHF is affecting the liver?
Well, there's a whole panel of liver function tests. Doctors use those to check up on the liver. They measure enzymes and other stuff that gets released when the liver's damaged or inflamed. And if those levels are high, it could mean the liver's being overworked or just not functioning as well as it should.
Wow. So even though we're focused on the heart, these tests make sure we're not missing problems with other organs.
It's all about getting the full picture. Now let's shift gears a bit and talk about cholesterol.
Okay, cholesterol. We know that's bad for the heart in general, but how does it tie in specifically to CHF?
Well, think of it like this. High cholesterol, especially that bad kind, LDL,
Right, LDL.
it contributes to plaque buildup in your arteries.
Uh-huh.
And that buildup, it narrows those arteries, making it harder for blood to flow through. So over time, that puts a huge strain on the heart.
Okay.
It weakens it, and it can lead to CHF.
So it's like clogging up the pipes, and your heart has to work harder and harder to push the blood through.
Exactly. That's why it's crucial to manage those cholesterol levels if you've got CHF.
To prevent even more damage.
Right, to prevent things from getting worse.
Okay. And last but not least, let's talk about the thyroid. I know it has something to do with metabolism, but what's the connection to heart health, especially with CHF?
Yeah, so both an overactive thyroid and an underactive thyroid can mess with your heart.
Okay.
Think of an overactive thyroid. It's called hyperthyroidism, like a car stuck in overdrive.
Okay.
It makes the heart race and work way too hard.
So too much thyroid hormone is bad. What about if it's too low?
Well, if it's underactive, that's hypothyroidism, and that can slow down your heart rate and weaken the heart muscle. It's like driving a car with hardly any gas.
Uh-huh.
It might keep going, but not very well.
So it sounds like having just the right amount of thyroid hormone is really important for the heart. How do they figure out if the thyroid's working right?
They do blood tests to check the levels of those thyroid hormones. It helps doctors see if it's functioning correctly.
Okay. Wow, we've covered a lot of tests. But one thing that really sticks out to me is that it's not just about one test result. It's about seeing how things change over time.
You're absolutely right. That's the beauty of trend analysis.
Mhm.
One result is just a snapshot.
Right.
But if you track those values over time, you get the whole story, the big picture.
Like watching a movie instead of just seeing one picture.
Exactly.
So how does that actually help with managing CHF?
Well, let's say someone's BNP levels have been steadily going down over the last few months.
Okay.
That's a good sign,
Yeah.
usually. It probably means their heart's not working as hard, maybe because the medication's working or they've made some lifestyle changes.
So it's not just the number itself, but the direction it's going.
Exactly. What if someone's creatinine levels are slowly creeping up?
Uh-oh.
Yeah, that could mean the kidneys are struggling, maybe because the heart's getting worse, or it could be a side effect of some medications.
So it's like an early warning system.
Exactly. So you can catch problems before they get really serious.
And then make changes before it gets worse.
Right, being proactive instead of reactive.
This is making me realize how important it is for patients to understand these tests. It's not about memorizing everything, but about getting the big picture.
Absolutely. The more you know about these tests, the better you can talk to your doctor and really be involved in your own healthcare.
Right. It's about being an active participant, not just a passive patient.
Exactly.
Yeah, it's about taking control, right? We've talked about how these tests can tell us so much about what's going on inside, but it makes me think, what can people actually do, like in their everyday lives, to help themselves, especially if they've got CHF?
That's a great question. And it really emphasizes how important those lifestyle changes can be. Sometimes they can be just as impactful as medication.
Okay, so what are some of the things that people can do?
Well, diet is huge,
Yeah.
like cutting back on sodium. That can help a lot with fluid retention,
Hmm.
which is, a big problem with CHF. And reducing saturated and trans fats, that's good for your cholesterol levels, so you can prevent more damage to the heart.
So it's not just about what you eat, but how much you eat too, right?
Both.
Especially salt.
Portion control is key. And of course, we can't forget about exercise.
Oh, right. Exercise.
Even moderate stuff, like a brisk walk a few times a week, can make a big difference. It strengthens your heart muscle and improves your circulation.
Like giving your heart a workout so it can pump better.
Exactly. And don't underestimate stress management. Stress hormones, those can really do a number on your heart.
Right.
Finding healthy ways to deal with stress, whether it's meditation, yoga, spending time in nature,
Uh-huh.
that can have a huge impact on your overall health, including your heart health.
It's amazing how those simple things can make such a difference.
It really is. And it just goes to show we've got more control over our health than we think.
This deep dive has been so interesting. We've really gone beyond just looking at these tests as numbers and seen them as clues to help us understand what's happening in the body, how CHF affects everything.
And, this is really just the beginning. The important thing is to remember, knowledge is power. The more you know, the better decisions you can make about your health.
Absolutely. So to everyone listening, whether you're dealing with CHF or just curious about these tests, don't be afraid to talk to your doctor. Ask questions. Talk about your results. You can work together to make a plan that's right for you.
Right. Remember, these tests are just one piece of the puzzle. Your doctor will look at your whole medical history, your symptoms, your lifestyle, and everything
Right. It's not just about one thing.
to come up with the best plan for you.
Yeah, it's a team effort.
Hmm.
And in the end, it's about remembering that you're not just a passenger in this journey. You're the driver.
Exactly. You have the power to make choices and take care of yourself.
Well said. Thanks for joining us on this deep dive.
You've been listening to the Learning Podcast, a production of metaNESTA. Remember, learning is a journey, one step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.